So today we are to look at yellow fever. Still Modrik's is the name I use. We are going to find all this information on the YouTube link that's already displayed on the screen. And for any more inquiry, you can follow me on Gmail. On that Gmail I already provided. And our today's purpose is to look at yellow fever. What is it by definition? We mention the causes of yellow fever. We shall explain the mode of spread and how to diagnose yellow fever. And lastly, mention the signs and symptoms of yellow fever. So yellow fever is an acute infectious disease caused by infection with yellow fever virus, which we call arbovirus. And this virus is carried to humans by mosquitoes by the name of Aedes and Haemogus. These are the two mosquitoes that are responsible for carrying arbovirus to humans. Or you can say yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquito. So this is one of the viral hemorrhagic disease, as well know others like Ebola, as well know other viral hemorrhagic diseases like Marburg. Also, yellow fever is one of them. The word yellow in the name yellow fever simply means jaundice that appears in most of the patients that have yellow fever. What is the cause of yellow fever? The cause of yellow fever is one, we call it yellow fever virus, and the name is arbovirus. That is the cause of yellow fever. It has an incubation period of 3 to 6 days. Incubation period, this is the time between successful inversion of the microorganism and the onset of signs and symptoms. So once one has encountered arbovirus, he takes a period of 3 to 6 days for him to show the signs and symptoms of yellow fever. And this time we are looking at the mode of spread. The spread to humans is through the bites of the mosquito. We are saying people themselves, through their usual contact, although the infection could possibly be transmitted directly into blood, they cannot spray yellow fever. So don't get worried to be with a colleague who has yellow fever, that maybe by touching him, you may get it. It is purely spread through human bites by the infected mosquito, which has already encountered arbovirus. But it can also be transmitted directly into blood through contaminated needles. That's how yellow fever is spread. How is yellow fever diagnosed as our next objective? We are saying for one to diagnose yellow fever, we shall base on the signs and symptoms, which we are yet to see, and there should be history of recent travel to some endemic area, which we know that people have yellow fever, and also can do blood tests. You can take off a blood sample for microscopy and shall be able to diagnose yellow fever. So what are the differential diagnosis or any other condition that may present the same like yellow fever? Commonly, there are two. We have malaria and typhoid. These two conditions typically have similar signs and symptoms like for yellow fever. So we are going to wind up as we share the signs and symptoms of yellow fever. And here they are. One is body aches, there is chills, fatigue, fever, there is severe headache, weakness, and lastly, which is the common one, yellowish discoloration of the skin, which you call jaundice. These signs and symptoms are similar to the ones even that appear in a malaria patient. But as I've said, for us to diagnose yellow fever, we base on recent travel and do blood tests to really check for this virus. Other signs and symptoms can also be like this. There is bleeding, there is nausea, there is vomiting, muscle pain, and liver failure. Thank you for listening. Let's meet in the next video as we share how to manage yellow fever, how to prevent yellow fever, and how we are going to see these complications that appear in yellow fever. Thank you for listening. You can follow this information on that YouTube channel on the screen.